Assalamualaikum. Today we are going to start how do we know when to discharge our patient. This is very important because at the start of the treatment we see the result, and after the result evaluation we go for discharge patient and give certain medicine along with the discharge to go home and take these medicines for the further treatment. So how do we know when to discharge our patient? This is very important. Now, achieve maximum benefit from skilled intervention means you have to provide the maximum benefit to the patient with your skills. When and where to intervene during the treatment for the putting the patient on the right track. Progress towards goals has plateau means improvement is there on the top. Determining factor for plateau, why it is going towards the betterment. We should know about the reasons also, due to the medication or after care or the nursing or something else. Changes in the medical condition, how the improvement is coming in the patient by seeing the vital signs, lab reports, physical limitations, how much he can move after the treatment, what improvement you can observe. The request for the self-discharge, maybe patient will request that I am feeling well and I want to go home, so you have to discharge. Physician discharge order based on physician examination. After the request of the patient, the physician will discharge the patient, make patient discharge order, and before that, he has to examine the patient. Is it in a condition to be discharged or not? Discharge to another facilities, maybe he is going from the card ICU to the ward or ward to the home. Patient expiration, if the patient will expire, then you have to discharge and you have to make a death certificate. So pursue the role of drug therapy practitioner over the drug advisor, over that of the drug therapy advisor, means pursue the role of the drug therapy practitioner. Who is giving the drug? The physician, the pharmacist, over that of the drug therapy advisor, who has advises this drug to the patient. You have to pursue that and see the role of the drug during therapy. The contribution of pharmacists serving as a drug information source means the whole burden comes on the pharmacist. He must have a drug information and he must become a source to provide information to other staff of the hospital. Source while actively participating as a member of a medical team. Medication therapy management, a range of services provided to individual patients to optimize therapeutic outcome, help patient gets the most benefit from their medication. If patient is not getting benefit from the patient, it means with the medication, it means it's a useless medicines. And detect and prevent costly medication problem. MTM means medication therapy management. MTM provides pharmacists the medication therapy experts result in a review of all medication prescribed by all prescribers providing care to the patient. Care to the patient and any over-the-counter and herbal product the patient may be taking to identify and address medical problem. Means MTM means when medication therapy management means provided by the pharmacist, and that medication therapy experts result in a review of all medications prescribed by all prescribers. Means maybe three, four doctors are prescribing a single patient. Maybe he has got a renal problem, he has got a cardiac problem, he has a digestive problem, maybe some problem are there. So maybe more than one prescriptions are there or more than one drugs are there. So you have to check it as a pharmacist. and over-the-counter OTC products, and maybe he's taking some herbal products that patient may be taking to identify and address the medical problem. What problem can come with those combination of alternative medicines? Problem may include medications not being used correctly, duplication of the medication, maybe same product is giving omeprazole are coming in 400 different brand names. Maybe the two prescribers are giving two different name brand. So you have to stop one. Unnecessary medication, maybe the doctor is providing unnecessary. For example, in hypertension, we provide according to the cause of the drug. If there is a excess cardiac output, we give beta blocker or calcium blocker. If there is excess blood volume, then we give diuretics. If there is a problem of kidney, then we use AC inhibitors. So in that way, we select the medicine and unnecessary product should be removed from that region. And need for medication for an untreated or inappropriate management condition. In in-depth medication related education, consultation and advice provided to the patient's family and or the caregivers to help assure proper use of the medication means you have to give an assurance to the patient that we are giving you proper medication. Collaboration with the patient physician and other healthcare providers to develop and achieve optimal goal of the medication therapy. Means if you want to give a best treatment, you must have a collaboration with your team, medical team, in which the physician, nurses and paramedical staffs all should be well aware of total treatment regime you have adopted. MPM is a part of the Medicare Part D drug benefit of the PDP and MAPD. MAPD means Medical Advance Advantage Plans, right? So Medicare Part D prescription drug plans, PDP, prescription drug plan, PDP, and the Medical Advantage Plan, MAPD, must have MTM program that provide appropriate services to the targeted beneficiaries to optimize therapeutic outcome. Under Part D, targeted beneficiaries are generally those with multiple chronic conditions taking multiple covered Part D medication and likely to incur annual medication costs that exceed a certain level, currently 4,000 for example, means you have to take care of the patient and take care of the patient how? Multiple chronic condition, if a patient is suffering, then you have to give multiple drugs. Taking multiple covered Part D medication program is you have to see that how can you cover this plan. And then you have to take care of the financial side of the patient also, that the load of treatment should not be very costly. Part D plan have a significant discretion in determining the number and types of the chronic condition and number of Part D medication that will qualify their beneficiary to receive MTM services. As a result, there is a considerable variation between the Part D plan, both with regard to who can receive MTM services and the type and comprehensiveness of MTM services that are provided. This variation, while understanding at the outside of the Part D program, is now resulting in some beneficiaries who could benefit from such services not qualifying for them within their plan. So even those things are not in your plan, even you can provide benefit for the MTM. MTM is not a prescription dispensing or disease management. It's entirely different. It's a complete plan. It's not simple a disease management. Prescription dependency, focusing on a medication products, providing the right drug to the right patient with the right basic information and how to use the medication. This is MTM. Means prescription dispensing focus on medication product. Our whole focus is on drug medication. providing the right drug to the right patient with the basic information on how to use the medication. As a part of the dispensing process, an offer to provide counseling and education on the specific product is made to the patient. Means you have to consult to the patient also and to provide complete information whatever the medication you are providing to the patient. Disease management activities focus on a specific disease in many aspects beyond medication use. Means in this disease management, what you do more than that, just providing a medication, but more things you have to go beyond your medical usage. It provides the patient with education. First of all, you have to educate the patient about the treatment and tools to manage their disease and include intervention focused on medical treatment, health screening, billing, wellness services such as the food examination, eye examination, blood test, and lifestyle modification focused on the improving the overall management of a specific disease, for example, diabetes management, asthma management, heart failure management. These are an extra things which is along with the patient. The focus on medication within the disease management program is limited to those medications especially used to treat the patient disease rather than the patient's entire medication regime. MTM focuses on ongoing management of the patient entire medication regime with the concentration on optimizing therapeutic effectiveness, preventing adverse events, and achieving optimal medication therapy goals. Active involvement of patients is critical, empowering them to be a full participant in their own care through better active involvement of patient is critical, empowering them to be a full participant in their own care through better understanding and use of their medication. MTM empowered patient, MTM encourage patient to be active participant in the healthcare. Means MTM is a specific program in which we take patient and provide him to participate in these activities, whatever the doctor and nurses and pharmacists is doing with him, empowering them to more knowledgeable about the responsible for their health and medication use. MTM services facilitate a more effective partnership among patients, their pharmacists, physicians, and other healthcare providers to achieve optimum medication therapy results. MTM services provide value. MTM services contribute to the safe, appropriate, and effective use of medication and offer value by providing the quality of patient care and outcome. So we are not just giving a medication, but we are providing quality of patient care and outcome. For example, disease, symptoms improvement, disease resolution improved, adherence and safe life. Reducing the healthcare expenditure, for example, reduction in expenses associated with physician visits, urgent emergency care visits, and hospitalization. So we also provide benefit to patient, the costs. Reducing the medication related adverse events, improving patient safety, evidence supporting the important healthcare outcome and benefit management of healthcare expenditure as that from the MTN services provided by the pharmacies is abundant in both the public and private sector. Recognizing the clinical role, recognizing the clinical role of the pharmacist in healthcare, a medication that fails to produce the desired or expected therapeutic outcome is clearly cost ineffective regardless of its price. If we are providing treatment to the patient and it is clearly cost ineffective, then it is useless. So that's why we are following the MTM services. The impact of inappropriate medication use and medication-related problem on patient morbidity and mortality has leading to policymakers in both the private and public sectors to recommendation provide the recommendation on effective strategies to address this significant public health problem. So even this is the duty of pharmacists to participate in MTM services and provide a better health to even the public. Following are among the many entities that acknowledge that pharmacists has the expertise necessary to effectively manage medication therapy and medication-related problems. The Institution of Medicine, IOM, of United States, in preventing medication error, quality Quality Chasm series recommend that patients be empowered for the safe and effective medication self-management and suggest that pharmacists and address these problems by becoming the manager of patient medication health. The Medicare Payment Advisory Commission, MedPAC, in their reports to Congress in 2002, recommended that the Secretary should assess model for collaborating drugs therapy management, giving considerable to pharmacies for the drug therapy management service in outpatient setting. The Center for Medicare and Medicaid Services in the final regulation for the medical Part D benefit state that the expectation that the MTM program must evolve and become Medicaid Part D benefit state that the expectation that the MTM program must evolve and become the cornerstone of the Medicaid prescription drug benefit. So we have seen that there is a lot of different organization involvement in the patient care, like CMS, like MedPAC, like IOM. So such type of organization will help out in the MTM, management treatment of medication. This is all about today. So we will follow next. एक दोस्त आने वाले हैं एक्चुअली मैंने इसलिए वो आमलेट का बंदोबस्त करने के लिए रखी है प्याज वगैरह ना अभी आ रहे हैं पता नहीं आते नहीं आते तारीख रोड पे से उनका फोन आया था मेरे पास डॉक्टर है नहीं नहीं खाने खिला दूंगा चावल बना हुआ है ना रोटी बनी हुई तो खिला दूंगा दाल भी है रोटी भी है ये मैं इसलिए मैं कहा आमलेट बना लेंगे साथ ना मैंने मिर्ची और धनिया तो काट दिया प्याज रख दिए मैं देखता हूँ अगर आएंगे अगर नहीं आए तो बेकार है थैंक यू बेटा मुझे दे रही हैं आप पापा मैं खा लूँ थैंक यू खा लो पापा खा लो चलो